You have been talking about getting physiotherapists and others within the healthcare profession to deliver vaccines for quite some time now?
Yeah, I've been mentioning it on Twitter for about a year, like since the first vaccine started rolling out.
And why does this make sense to you?
Well, I just feel there's so many allied health professionals that have the professional skills to be able to do this, that, you know, we could increase our capacity to a rate that would allow us to get needles into arms quickly. They're asking nurses, nurse practitioners, family physicians to, you know, temporarily put their stuff on hold and go and help the vaccination clinics. And we could be there too.
Why would you qualify for this? Tell me what it is about your job that you do that you could qualify for this.
Okay, so I have a master's of physical therapy from University of Toronto. I have taken countless hours of courses in acupuncture, dry needling, IMS. I spend all day long doing needling on people. And we have, like, you know, we're used to dealing with patients, we're used to dealing with needle phobia. Physiotherapists tend to be really giving people, just like all healthcare professionals. And I think we would show up in, you know, the masses to just volunteer.
Who else would qualify for this type of thing, just to get as many needles into arms as possible?
I could see dentists doing it. I could see veterinarians doing it. You know, even some massage therapists have needling skills, and they certainly know their anatomy.
Yeah.
It's your deltoid and IM injection. I think we could easily be taught that skill and be able to do it. We want to help, and we just want to be part of it, and I want to see doctors and nurses having a bit of a break, and also, you know, not having the weight of it being completely on their shoulders. There's other people who can take some of this burden so that then they can do their jobs that we can't do. I can't replace a GP, I can't replace an emerge nurse, I can't replace an ICU nurse or a doctor, but I think I could step in and do a vaccine. I don't want this to be added to our scope of practice indefinitely, but I think that we need to keep the doctors and nurses doing the things that they need to do to keep our medical system from totally collapsing. And there's a whole bunch of allied health professionals out there that have the skills, that have the knowledge, that have, you know, anatomy expertise that aren't being utilized.